Welcome to the Kurist podcast. Today, I am joined with Dr. Batal, who is one of our physicians on the platform. Welcome to the podcast.
Thank you for having me.
All right. Well, I would just love to touch on a little bit what you do day to day. Let's start there.
Okay. I'm a general cardiologist, so I see patients across the spectrum of general cardiology, from prevention to people with established disease, people with more challenging cases. I treat them medically and also follow them up with imaging. A lot of what I do is imaging. I do a few procedures, namely transesophageal echo or cardioversions, but mostly it is taking care of patients directly and following them up with medications and imaging studies.
Okay, great. Well, that's awesome to hear. As a cardiologist, how do you feel that Kurist and the second opinion aspect of it is helpful for potential patients you may see on the platform?
One of the main things is to make sure you have the correct diagnosis. Once you have the correct diagnosis, the treatment, generally speaking, is more straightforward. In cardiology, we have a lot of treatment options once the diagnosis is established. So I think it's a very good opportunity to reach out to more population of patients, help patients that may be in need of figuring out what is exactly going on, introducing them to the current therapies if there is any further opportunity to optimize their medications, telling them about lifestyle choices that are helpful. I could also, the Kurist platform is very easy to use, and it'll allow us to look at their images directly if they upload the file that they have a consult about. So I thought that it was a very good opportunity to help people that we would not be able to reach out to otherwise.
Yeah, no, I think that's a great point. And I mean, you kind of touch on it, but I think Kurist does make a very big effort to ensure the user-friendly aspect of it, both for the patient and the physician. So that's awesome to hear. And then also you touched on this. So as a cardiologist, you mentioned a lot of the lifestyle decisions and changes can really affect someone. Could you kind of elaborate on what different lifestyle changes you're talking about?
So in general, there is the medication aspect. The medication aspect can work for a lot of patients. There's a lot of new medications that have come out that can help patients get better. But not everyone responds to the medications as well as others. There's tailored therapy. And in general, when someone focuses on making their body stronger, it allows them to be less dependent on a lot of medications and help them recover better. So there's always the medication aspect, but the lifestyle aspect complements it. And if someone combines it correctly and follows up with motivation, they could have a better outcome.
Absolutely, absolutely. What do you think is the most complex issue as a cardiologist that you could help provide that second opinion expertise to improve?
Okay. So if someone has symptoms that are not well explained, or they're not responding as expected to a certain treatment, it is worthwhile to revisit by reviewing the imaging, by reviewing the lab tests, and making sure the correct diagnosis is established.
Okay.
Sometimes the diagnosis may be not straightforward, or there may be more than one thing going on. So it's best to review the whole case, get a second bird's eye view of everything. And that way we could make sure that the diagnosis is established, and then see if there's any side effects to a medication, or there should be an alternative medication. Some people may have a non-specific response to a medication where another one may work better for them.
And you said non-specific medication. What do you mean by that? This is from a non-physician.
A non-specific side effect. Like instead of them not responding to the medication, they may be not tolerating a medication well. It may need to be adjusted.
Okay, that makes sense. All right. Thank you for elaborating. All right. So another question for you. Obviously, with today's society, and we see a lot of things, especially after COVID, it kind of took that remote turn. And we've been now introduced to an almost wholly virtual world that, I think is in our near future. How do you think that the world of cardiology, how do you think that is going to change as we continue to project ourselves into a highly digital world?
I think that still an in-person visit is very important. getting a second opinion is helpful, but
Sure.
having hands laid on the patient and examined is still important
Absolutely.
in certain cases. That being said, there's a lot of diagnostic tools that could complement. And when you combine that with reviewing the records,
Mhm.
it can still be, most cases could be figured out still virtually.
Mhm.
I think there are some cases where you may need to see a patient, and I think that's one of the limitations, but it will
Absolutely.
probably not apply to the vast majority that will be able to help. Of course, technology is great and it can help a lot of people, but there's some people that may need an in-person visit. And in
Mhm.
those cases, we could advise them that if they're still having difficulty locally, they may have to travel
Absolutely.
to get the diagnosis
Yeah.
or a better response. And we'll advise people about that if
Yeah.
that comes up.
I always say I think technology is great. I think it can help physicians and doctors, but I could never imagine a robot operating
Mm.
on me,
Yeah,
touching like the
yeah,
insides of like if
yeah,
I ever had to get a surgery. So it's
yeah,
definitely very interesting, and it makes
yeah,
me happy to hear that you
yeah,
said technology can help.
mm,
But for me personally, I
yeah,
feel like. And
yeah,
this could definitely be a hot take. I feel like it
mm,
will never replace physicians. And I mean,
mm,
also specific practices, one such as cardiology, I feel like it does require that in person
mm,
aspect, whether it's, you need to hear a heartbeat, you can't really do
mm.
that online, or you need to listen for certain things or feel for certain things. You can't do that completely virtually. So,
Yeah, some
um,
things can't be done
yeah,
virtually.
definitely.
Yeah.
Yeah.
Mm,
Well, one final question for
mm.
you. Looking forward, what is something you are most excited about as a cardiologist to collaborate with Kurist on?
I think that if there's a if there's an opportunity to teach how to establish a robust imaging program, for example,
Hmm.
or to establish like a revision of certain challenging cases in imaging, or even if there is an opportunity to teach aspiring physicians on how to read complex cases in
Hmm.
imaging, and also like presenting complex cases or reviewing them as a collaborative group, not just with a patient interaction, but sometimes with physician interactions.
Yeah.
Just like sometimes there is heart conferences that we do locally.
Hmm.
Perhaps some of these cases may benefit from a conference. It doesn't have to be with one physician on Curist. It could be sometimes multiple.
Hmm.
That way, the patient will get the benefit of having multiple opinions, different specialties weighing in, all
Sure.
related.
Yeah.
But I think with a robust system and the platform, this could be possible.
Absolutely. No, that was a great response. And
Yeah.
thank you so much for joining us, Dr. Batal. It's been an
Yeah.
absolute pleasure
Wow.
and getting to kind of hear your point of view and what you do. So thank you so much for joining us
Well, thank
today.
you for having me. I'm
Thank you.
excited for your program and I wish it success.
I'm excited to
Mm.
collaborate. I can't wait.
Yes. Mm.